Hello, you're welcome. My name is Dr. Chris Williams, and I'm your host on Well Again. Well Again is your online health magazine program in which we explore fail-proof principles and protocols for regaining health and retaining health. You're welcome. Today we want to discuss something very important, but before I go on, I would like to encourage you, please help subscribe, okay, and then drop also your notification, open your notification so that when we have new videos, you will be notified when it does come. All right, also help us share it with friends and families and your well wishers. Let's all work together to see if we can create a more healthy world. You are welcome. Also, it's important to say that these things we're saying here are for information purposes. They are not prescriptions per se. Before you take any of the actions that we're talking about here, or suggesting here, or just talking about here, you need to consult your doctor, because some of the things may be contraindicated in your particular case or in your particular makeup. All right, please do not forget, it's very important that you subscribe and then you also watch out for these videos. Now we are talking today about lupus. Lupus is an autoimmune disease. It's a group of autoimmune diseases. By autoimmune, we mean that it's a group of diseases that it belongs to a group of diseases that in which the immunity of the body attacks itself. The immunity of the body attacks itself. The immunity of the body is supposed to defend the body, but however, the immunity is overdriven. The body ends up attacking itself and destroying the tissues of the body. There are about 4 types of lupus. There is diffuse lupus erythematosus, okay, and that one it's a milder, more localized one, okay, and it's also bad, but it does not end up being life-threatening. What it does is that it can end up with a chronic disfiguring skin lesion, okay. There's also systemic lupus erythematosus. This one can really be life-threatening because, just like its name goes, it affects multiple organs of the body. It can affect the skin, it can affect the kidneys, it can affect the lungs, it can affect the heart, it can affect even the liver and even the brain. Okay, at the end of the day, it can even kill the person. So that's what lupus is, systemic lupus erythematosus. It occurs more in women than in men. Okay, and usually in women between age 15 thereabout and 45, lupus occurs more than in other ages. By the time women, that's about 90% cases of lupus are between the age 15 to 45. Now, by the time women are getting to 50, the prevalence or the occurrence of lupus in women above 50 drops to about 75%. Okay, maybe because it has killed them off by that time or something. All right, it occurs less in men, but when men also get to about 50%, we see an increase of about 25% occurrence in men. Now that suggests something very important. What it does suggest is that it's a disease that is most likely connected with estrogen dominance in the body. Okay, very important. We've talked about estrogen dominance before. Okay, that's a very big clue, because when women are menopausal, the estrogen has dropped, and then by the time men have reached 50, their testosterone has dropped, and then the ratio of estrogen in their body has increased. All right, so that's that. Lupus can be mild, it can be moderate, it can be severe, and it can actually be life-threatening. By the time it affects the kidneys, the lungs, the liver, by the time it attacks the heart, it can literally claim the person's life. What are the features of lupus? What are the features of lupus? It may start by some characteristic rash on along the nose and the cheeks of the person. Red characteristic rash, both the diffuse and the systemic. Okay, and then the person, it can also present like arthritis or something that resembles rheumatoid arthritis, where there's swelling, stiffness first of the fingers, and then there is swelling of the ankles and swelling of the wrists, and then also swelling of the ankles. There may be acute fever. This person may be having fever, and so it presents like an infection. All right. There can also be red scaling rashes that are scaling off, and they are reddish on the skin or other parts of the body. It can present with abdominal and chest pain. It can present with blood in the urine, sores in the mouth. Sufferers will begin to have sores in the mouth, and then before you know it, they begin to experience hair loss. Their hair begins to fall off. It can also present with loss of appetite and low-grade fever. We have talked about low-grade fever. It can come with nausea. Nausea is the feeling to vomit, and then there's more poor circulation in the fingers and in the toes. As it progresses, it can lead to shortness of breath, and then the person can have ulcers that are not healing because there's poor circulation in the extremities. So if an ulcer occurs there, it may not heal on time. It can also present with weight loss. It does also present with weight loss. The person will begin to lose weight. Okay, there can also be anemia. There can be anemia, and then amnesia also. This person begins to forget things, and that they begin to forget things. There can also be depression. Of course, when you are sick like this, you will tend to start having depression. Now, also headaches can also begin to happen, and then it can lead to paralysis. I mean, it's a very terrible thing, especially we're talking about the systemic lupus now. It begins to affect everything in the body. Everything literally begins to go wrong. When it affects the brain, it can lead to mania and psychosis and paranoia. Literally, the person begins to go mental. Okay, and then there's risk of increased heart attacks and strokes, and then also infections, because it will also attack the bone marrow, and then the person cannot form white blood cells any longer. All right. If you go to the hospital, there are different things that the doctor will use to diagnose it. Okay, they will check the platelet count, they will check the white blood cells count, and then the arthritis is significant in diagnosing it. The rashes are also significant. Occurrence of mouth rashes, mouth sores, diagnostic, and then if the person is having blood in the urine, it's also diagnosed. And then there's a factor called the lupus factor that they can see in the person's blood. Okay, it can also help to diagnose it. Now, what are the lifestyle changes that somebody who is battling lupus need to take on? Very important. You first of all, the things to avoid. You will need to avoid fatty foods. You need to avoid animal proteins. I usually will recommend do away with animal proteins, eggs, milk, beef, chicken, turkey. Do away with them. Stay with fish, and then very little fish also. Don't abuse fish. The drier, the better. Okay, so the person will, by the time you remove all these things, you have removed a lot of fat from your food. Okay, so you have also removed a lot of animal proteins from your food. We have said remove milk and dairy products from your food. Okay, and then you need to reduce your salt. If you must use salt at all, use Celtic sea salt, or use Himalayan salt. All right, this person also needs to avoid citrus fruits, that's oranges and all that, and then you need to avoid alcohol, you need to avoid smoking. And then if you are dealing with lupus, or you want to avoid lupus, you need to also remove things that are sweet from your food. Sugary things, remove them from your food. Sugar never helps us. In close to 15 years of doing natural health, I've not come across one condition that sugar helps to make better. Even when people are having low blood sugar, and then some doctors ask them to start to be looking sugar, that is it's a panacea. It's a short-lived panacea. Right away it will help the person, but on the long run it is killing the person. All right, so very important. You also need to avoid nightshade plants like eggplants, okay, like tomatoes, like pepper. You need to avoid them, very important. Okay, you need to also avoid a strong sunlight. It's important to avoid strong sunlight. It's very important. And then if you must use chemical soaps, you must use very mild ones, hypoallergenic ones, very important. Mild soaps and cosmetics. But if I were you, I will use naturals. I'll go for natural soaps, black soap, and then also creams that are natural. Very, very important. In your living spaces, in your bedroom, remove fluorescent lightings. Remove fluorescent lightings and replace them with incandescent bulbs. Fluorescent lightings are not good. They tend to cause the SLE to flare up. Very important. You also need to avoid crowds, so that because your immunity is shaky, so that you don't keep catching infection every other time. And then you need to do away with birth control pills. It's so very important. You see what I was saying about estrogens? Most birth control pills are made from estrogens, okay, and then some of these things that we just mentioned, they are the things that cause the body to begin to attack itself. Any person suffering lupus must work towards balancing their estrogen levels. It's so very important. Now, so those are the things to avoid. Those are the things to avoid. What should you eat? Also avoid refined carbohydrates. Avoid refined carbohydrates. Go for carbohydrates, millet, oats, grains, all grains that you mill yourself and that you are eating, you are using to make meals at home. Very, very important. Very, very important. Remove refined carbohydrates from your food. Sparks, pastas, pastries, remove them from anything made from flour. Remove it from your food. Very important. Go for oats, go for whole grains. Very important. And then you go for brown rice. Brown rice is helpful. It contains a whole lot of fiber that keeps your colon decongested. All right. You need to eat a whole lot of garlics and onion. You need to eat a whole lot of garlics and onions, okay? And then eat a lot of green leafy vegetables, okay? As a matter of fact, you can blend vegetables and drink them. You can blend vegetables and drink them, okay? Green leafy ones, you can blend them and drink them, all right? So those are the things to do concerning your feeding. Now, let's talk about the supplements that you can use. Let's talk about the supplements that you can use. All right. You can, if you are dealing with lupus, you need to be on regular daily doses of calcium and magnesium. Magnesium helps calcium to be more absorbed into the body. Those two work together, about 1,500 milligrams of each of them on a daily basis. It helps. These two help to balance your pH, okay? That means also anything you do to alkalize your body helps you, okay? So that in that wise, if you get an alkaline drop and you're alkalizing your water, it does help you. You need good supply of essential fatty acids, omega-3. It's so very important. So you get good omega-3, shark cartilage, creolic, and all that. They also help you. Some amino acids that you need: L-cysteine, L-lysine, L-methionine. These are amino acids, and they are really very good. Especially the L-lysine, if you take it along with the vitamin C, just about 100 milligrams of vitamin C and vitamin B6 pyridoxine. These help L-lysine to be better absorbed into your body. You also need acidophilus. You need acidophilus to keep your colon cleansed. From my research and my studies and my knowledge of natural health, most chronic diseases begin to happen because the intestines have started malfunctioning. So if you must deal with any chronic disease, you need to heal your intestines. It's so very important, and in that wise you need acidophilus. Acidophilus helps you to heal your intestines. They are good bacteria that you supply to your intestine, and then it reduces the load of bad bacteria, and your intestines are able to function well. You also need proteolytic enzymes, pancreatic enzymes that help you digest food better. You need them also. Okay, the proteolytic enzymes are heavily anti-inflammatory, and they are also very good antiviral agents. Garlic capsules is very important. Garlic is very strongly anti-inflammatory. We have said that over and again, very important. And then some other things for your joints. Glucosamine. You need glucosamine for your joints. In fact, the N-acetyl glucosamine, popularly known as NAG, not NAC, NAG. N-acetyl glucosamine, it's very good for the joint health. It helps to repair the joint. You also need some glandulars. You need raw thymus glandula, and then you need raw spleen glandula. Raw thymus glandula, raw spleen glandula. Please do not forget, these are for information purposes. They are not prescriptions, so you need to check with your doctor before you can use any of these things. It's so very important. It's so very important you check with your doctor before you can use any of these things, okay? Because some things sometimes are contraindicated in some person's bodies or in some person's particular case. Sometimes it's not only, well, if you are suffering lupus, it's not only lupus you are suffering one thing or the other. Okay, so you need glandulars, I was saying, raw splenic glandula and also raw thymus glandula. These two will help you to heal your spleen and heal your thymus. Okay, and then because in the thymus and in the spleen is where they are a major place where your immune system is being replenished from. All right, now we said SLE or lupus is a disease in which this immune system is overactive. We didn't say it is so some people will say, why do we need to help it? Okay, so the reason we need to help it is overactive and sick. Okay, so we need to some of the immune defenders, the WBC and others, they have gone nuts. They are not properly being made, so that's why they are misbehaving. They are like officers at war. You know, they are on rampage. They are no longer following the guidelines. So you need, and it happens when some of these places, the spleen, the bone marrow, the thymus, are sick. So if you heal those places, they will be able to produce better, more level-headed, more cooperating WBC, and the healing will be better. What other supplements do you need? You need zinc. You need about 100 milligrams of zinc on a daily basis. Zinc, very important. And then you need to take it along with copper. There's a way that zinc and copper work together to be able to absorb better into the body. You need about 3 milligrams of zinc into your body. Please do not forget, these are for information purposes. You need to cross-check with your doctor before you take this. All right, okay, I've talked about the importance of acidophilus in the protocol. You also need to take kelp regularly. Kelp will help your thyroid gland. Okay, it will help your thyroid gland. And then if your doctor, your natural doctor, thinks it's important, you may need to add lugol iodine to your protocol. All right. You need good supply of vitamin B's. We've talked about B6 earlier. Generally, vitamin B is good supply of it. You need good supply of vitamin A, very good supply of it. We've talked about your need for shark oil or krill oil, which is fish oil. It's very important. You need bromelain. Bromelain is an enzyme that you get from the back of pineapple, and it's a very good enzyme. It's anti-inflammatory. It also helps digestion. Bromelain is very good. Some practitioners will say you should be eating pineapple, but I don't encourage it because there's sugar in pineapple. So go for the enzyme. If you're wondering where you can get all these things, if you contact us, we'll tell you where to get the good ones, because some of the ones in the market, they just carry names. They are not doing it. The more organic the ones you get, the better they are able to do the work. It's so important. Contact us. All right. And then you need to keep your colon cleansed. It's so very important. So you need Plantago Vata, you need LD pap, and then you need detox tea to keep your colon cleansed. The freer your colon is, the faster, the healthier your colon, your intestines will be, and then the faster your healing will be. All right. It's so very important you know that. We have some books, several of them, that are on sale. We have sickness free. There's also reversing hypertension and cardiovascular diseases naturally, and then there's also reversing depression naturally, and there's also reversing diabetes naturally. All these are things that you can take advantage of as you pursue a better health. All right. Do not forget, we didn't prescribe. We just gave informations. You need to clarify with your doctor if you must use these things, and then if you need to know where to get the real ones, better ones of all these things, we can tell you they are around. Okay. I know some of the names will sound strange to some people, but you can get them so that you can attack what you are going through, and you can live a good life. You can live a good life. There are many people who are suffering autoimmune diseases, but I met a preacher recently, a lady in her 50s, who is battling rheumatoid arthritis, but I didn't know until she told me. Very busy, very vibrant preacher, and she has been dealing with it for several years now. But all I noticed was that she was very finicky with what she ate. She had learned a lot about it. So with diet and with supplements and with lifestyle, good exercise, there are very few sicknesses and conditions that you cannot curtail, even reverse, if possible. All right. Thank you so much for viewing today. Do not forget, subscribe, turn on your notification. It's so very important, and then share with friends, share with family, and then let's have your comments. If you reach us on some of these on the number, to SMS, to WhatsApp, we'll be able to return to you. We are very busy, so many people trying to get to us, so you need to be patient, but definitely if we see that your request is very, very important, we will surely get back to you. Thank you so much. Bye bye. God bless you.